Hello everyone, I'm Abby and today we will be discussing two different pathologies. One pathology will affect the bony skeleton and the second one will affect the thoracic abdomen area. So before we get started, we first need to know what is pathology. Pathology is the scientific study of disease, focusing on the study of diseases, the structural and functional changes they cause, and any abnormal condition. Now that we have gone over what is a pathology, the first one we will be diving into is osteogenesis imperfecta. It is a brittle bone disease. That's also another name for it. It's a rare genetic disorder that affects the body's ability to produce collagen. Collagen is a protein that we need to provide strength and structure to our bones and connective tissue. Because individuals lack this collagen, their bones are more frail than the average human. There are several types of brittle bone disease, ranging from mild to severe. There can be respiratory complications as well as severe skeletal abnormalities. Type 3 and 4 cause varying degrees of bone deformities and frequent fractures throughout life. On to bodily impact. So, brittle bone disease affects multiple body systems, those systems being the skeletal system, the teeth, hearing, respiratory function, connective tissues. Patients often experience recurrent bone fractures, short stature, curvature of the spine, scoliosis and kyphosis, discoloration of the sclera of the eyes. It can also be purple, gray, those type of colors. You have joint hypermobility, so the same range of motions that an average human have, they do not have. They can develop hearing loss during their adulthood, as well as the bone deformities worsening over time. Because the disorder affects collagen production throughout the body, complications may extend beyond bones themselves. Severe cases can cause respiratory difficulties because chest wall deformities may impair lung development. So, as we all know, if you breathe in, your lungs expand. So, with that expansion, those ribs are so fragile that they break and penetrate the lung, causing hardship on breathing. Brittle bone disease, like any other disease, comes with its specific symptoms. Some of those common symptoms are frequent fractures, chronic bone pain, skeletal deformities, muscle weakness, delayed growth, hearing loss, dental abnormalities known as dentogenesis imperfecta, limited mobility. So the severity of symptoms vary greatly depending on the type of brittle bone disease you have. First, we have type 1. Type 1 is the mildest and most common form of this disease. The bones fracture easily, especially before puberty. Minimum bone deformity, normal or normal stature. Eye color can be blue, gray, or purple. There is possible hearing loss in adulthood, and there's mild to no dental issues. With this type, the life expectancy is generally normal. Fractures decrease after puberty. The next type is moderate. It is type 4. It is between type 1 and type 3. The bones fracture easily, mild to moderate bone deformities. Here comes the short stature, normal and slightly blue eyes. Dental issues also become into play with this. Possible hearing loss. The life expectancy for this one is near normal. Fractures occur throughout the life but are less severe than type 3. Now we have type 3, which is more severe and progressive. It's severe, but it is also compatible with life. The bones fracture easily, progressive bone deformities. There comes into play a very short stature, spinal curvature, which is that kyphotic and scoliosis we mentioned. The eyes are blue. They may fade with age. There are dental issues and possible hearing loss. There's lifelong fractures and deformities. the mobility may be limited. And then also the life expectancy goes down the more severe the condition gets. Last but not least, we have the lethal type 2. Fractures occur before birth. There are very severe deformities, and death is shortly after birth. Brittle bone disease is rare. It affects a great bit of the population. It affects tens of thousands in the US and hundreds of thousands worldwide. It is not specific to any ethnic group, so it varies widely. Early diagnosis, genetic counseling, and supportive care are key to improving quality of life. Both children and adults can get this disease. It is also most common in those who have consanguineous marriages. That means they are in some form or shape related. About 6 to 7 per 100,000 people are affected. In the US, an estimated number of people with this disease is 25,000 to about 50,000. This disease is mostly inherited from one parent. Medical imaging plays an essential role in diagnosing osteogenesis imperfecta. X-ray is usually the first imaging modality utilized to show this disease. On these X-ray images, they may demonstrate multiple fractures, bone deformities of the long bones, osteopenia, thin quarter bone structures, rib fractures, and wormium bones. You can also use bone density exams, CT imaging, as well as prenatal ultrasound to diagnose this disease. But while performing these exams, note that the technologist must exercise caution when positioning the patients because of excessive movement or improper handling may increase the risk of a fracture. The radiologist will typically find osteopenia, multiple healing fractures, bowing of the femur or the tibia, thin ribs, vertebral compression, and skull abnormalities on these radiographs. Here are some images that I've inserted to show you the different types of deformities that come with this disease. So in the first image, you have that bowing of the femur as well as the fib tip. In the middle image, you have wormium bones. So these are the little small bones that primarily lie on the occipital sutures. And for the third image, it's a chest radiograph showing anaphylaxis of the right upper lobe. Bone disease is not a disease that can be treated in a way of being cured. It still needs to be treated in order to manage the pain. So one way is medical management is by either oral or intravenously medication. That goes for the children or the adult. You also have physical therapy. It improves gross motor skills, prevents fracture, and safely guides daily activities. Then you have surgical interventions. Surgery may be necessary to repair fractures, correct bone deformities, or stabilize the bone. You also have supportive care and lifestyle adaptations. Mobility aids such as walkers, canes, crutches, braces, or wheelchairs. Most people with brittle bone disease you will see in a wheelchair. Now we will be diving into our second pathology, which affects the thoracic abdomen area. So that pathology is bowel obstruction. It is one of the most common surgical emergencies involving the gastrointestinal tract of bowel obstruction. This occurs when the normal passageway of the intestinal contents becomes blocked or partially blocked. Obstruction comes with a grave impact on the intestines. So you have intestinal dilation, reduced blood supply, bowel perforation, which is pressure in the blocked intestine, can cause it to rupture, leading to a dangerous leakage of its contents into the abdominal cavity. You have electrolyte abnormalities. This obstruction can disrupt the balance of essential minerals in the body, leading to electrolyte imbalances that can affect your overall health. You have infection. You have increased risk of bowel ischemia, which is decreased blood flow to the bowels, which can restrict or stop movement of the intestinal muscles. And then you also have gangrene. If left untreated, portions of the intestine may lose their blood supply and become necrotic. Moving forward, we will talk about some symptoms of bowel obstruction. Some symptoms may present as severe abdominal pain, nausea, vomiting, abdominal distension, constipation, inability to pass gas, decreased bowel movements, dehydration. You have partial bowel obstruction as well as complete bowel obstruction. Partial bowel obstructions may cause colicky abdominal pain, diarrhea, and excessive gas. A complete bowel obstruction presents as severe sudden abdominal pain, inability to pass gas or stool, and a loss of appetite. Globally, about 3.2 million cases of bowel obstruction were reported in 2015, resulting in 264,000 deaths. Even though bowel obstruction occurs in patients of all ages, it is most common in older adults, patients with previous abdominal surgeries, individuals with hernias, patients with inflammatory bowel diseases, cancer patients, and patients with intestinal tumors. The most common cause of small bowel obstruction is post-operative adhesions resulting from previous surgical procedures. This pathology can be seen by x-rays. On those x-rays, diluted loops of bowel are demonstrated. Multiple air fluid levels are demonstrated, as well as absence of gas within the colon and the stepladder appearance. Even though we sometimes use x-ray, CT is the gold standard for diagnosing bowel obstruction. CT helps to identify the location of the obstruction, determine the severity, detect complications, demonstrate bowel wall abnormalities, and evaluate blood supply to the affected structures. Some findings on these radiographs can include diluted bowel loops, multiple air fluid levels, a collapsed bowel distal to the obstruction, string of beads appearance, and transition points identified on CT imaging. Again, we have a few images that I've inserted to demonstrate what it looks like on CT and X-ray. So the first image, the arrows are pointing to the narrowing of, of the intestine. So with the narrowing of this intestine, that shows a closed loop obstruction. Inside of the second image, you have a fluid-filled small bowel and decompressed distal small bowel consistent with obstruction. The arrow shows a representation of a gallstone that eroded from the gallbladder to obstruct the small bowel. And as for the third image, you can see those small little gray dots that are over the right lower quadrant. It is representing hernia repair. So this common pathology, unlike others, is treatable. You can treat it by medications, intestinal decompression, a colic stent, or surgery to remove that obstruction. Brittle bone disease and bowel obstruction are two distinctive pathologies that significantly affect a patient's health and quality of life. The knowledge and skills of both technologists and radiologists are essential in the diagnostic process. As future rad techs, understanding the clinical presentation, pathology, and imaging characteristics of diseases enables us to provide exceptional patient care and diagnostic images. So that is all we have on the pathologies. Thank you for your time.